And what about for anybody thinking, well, then if that's the case, why don't I just go get it on purpose, boost my immunity? And experts say there are a number of reasons why you don't want to do that. Dr. Perry Wilson is Associate Professor of Medicine at Yale. Dr. Wilson, good morning. If it will ultimately find most everybody, then why would ripping off the Band-Aid not be a good idea?
Yeah, I mean, I get the rationale. And for people who, are healthy and fully vaccinated and boosted, even if they get it, it's going to be a relatively mild infection. But here's the thing. If everyone made that choice, excuse me, if everyone made that choice right now, we're in a situation where there are more people hospitalized with COVID than at any time in the pandemic. And the hospitals are under incredible stress, and that hurts people even without COVID. And so we can't have the rapid spread of COVID at this point in time because it's going to overwhelm the health system. It already is. So we need to ask people, even if they think they'll do fine with COVID, and many of them will, to try to avoid getting infected as long as possible so we can relieve the strain on the health system and protect everyone who needs hospital care.
Yeah, what I'm hearing from you is it's not all about you, it's about other people and the impact on them. New masking guidance is coming. What would you like to see in that?
We're expecting the CDC to upgrade their recommendations for what kind of masks people should be wearing to the N95 kind. Here's mine right here. So many of us have these, but if you don't, these are specialized masks. They fit a little tight around the face. And according to a new study from the Proceedings of the National Academy of Sciences, they're about 75 times more effective at preventing the spread of coronavirus than those traditional cloth or surgical masks. And given how infectious Omicron is, it might be a really good idea to upgrade to this kind of mask. I actually find them quite comfortable, but if you can find one reasonable choice.
Okay, question, it just occurred to me. What's the difference between N95 and KN95 masks?
It has to do with how they're regulated. In terms of their ability to filter particles, they're essentially the same. So no need to worry if you're finding an N95 or a KN95. It has to do with certain manufacturing principles, but they should both work equivalently.
How long do you recommend that children at school be in masks if there is a choice?
Yeah, well, I don't think we're going to see large-scale changes on the recommendations for children and masks until we're over the crest of this wave. Now, Omicron, there's some early data suggesting we might be hitting a peak, and I'm crossing my fingers for that. When we get beyond this wave, there's going to be a lot of population-based immunity. Some people are even talking about the effective end of the pandemic and COVID transitioning into an endemic disease, and that might be a time where we can remove masks for kids in school, but we're probably not there yet.
Dr. Perry Wilson, good to talk to you. I appreciate you.
You too.
All right.